Hello, everyone, and welcome to today's live. I'm glad you're here. So let me guess. You were probably searching on YouTube and looking for things like my baby is 9 months old and they're not crawling yet. And you're wondering if that's a normal delay or if it's a red flag and you should be concerned. First of all, you're not alone. I get this kind of question every week when I go to parents' homes where they're asking, am I behind? Is my baby behind in terms of their gross motor milestones? When is baby going to start moving? When is baby going to start crawling? Why is my 9-month-old, 10-month-old, 11-month-old still not crawling? I've been a pediatric physical therapist for well over 25 years, and I show parents just like you every day how to use simple touch and movement in order to help their baby to become stronger and smarter. So let's dive in and start talking a little bit about crawling. Let's take a look at how your baby starts crawling, why your baby might be a little bit behind, and some action items that you can do, when you should be concerned, when you should seek help, and some things that you can do starting right now, starting today. So let's take a step back and look at understanding crawling development. Crawling doesn't just start, you look around one day and your baby is halfway across the room crawling. It's a progression. It starts with lots and lots of tummy time. If you put your baby on your tummy, baby's going to start pushing themselves up and gradually lifting that head up, pushing their hands on the ground, trying to push that chest up off the ground. And eventually, this is going to lead to your baby being able to move. So that's the first stage, is crawling, pushing themselves up on their hands. It's important to remember that most babies crawl between 7 to 10 months. Now, why do I say that? I say most babies crawl between 7 to 10 months because not all babies do. Every baby is different and every baby develops at their own pace, develop with their own timeline. And so things might happen that cause your baby to be a little bit behind. If your baby was born premature, for instance, then your baby will be a little bit behind in terms of this gross motor milestone, maybe outside of that window. Your baby may not start crawling until they're 10 or 11 or 12 months old. We've got to give those premature babies a chance to catch up before we can start expecting them to actually move ahead. So let's go ahead and go through that progression of what causes a baby to move from tummy time to being able to crawl. So baby starts off, like I said, with tummy time. Then baby moves to where they're pivoting on their tummy and getting up on their tummy and moving around. So let's go ahead and remove this one off of the stage. Remove that one. And this is what I like to call the tummy time pivot. So the tummy time pivot is very simple. You put your baby on their tummy, put a toy off to the side, and cue your baby to try to stay on their tummy and just pivot to go get that toy. You can see right here, I'm giving this baby quite a bit of comfort. I'm helping him to relax. And I'm showing him the toys and getting him engaged with the toys, especially if your baby doesn't like tummy time. Some babies, you can see that he is trying to roll out of the tummy time position, and I'm keeping him engaged with the toy to try to cue him to stay on his tummy and do that tummy time pivot for me. Now, this is a very important stage, and I like this stage because it is one of the easier ones for a baby to be able to do, especially a baby who is struggling with tummy time. You can, a lot of times, baby put their hands up in the air, their feet go up in the air, and baby does not know what to do or how to get themselves back down from that position. So that is an important thing for baby to learn. If you have your baby on their tummy and baby kind of puts their hands up in this position, brings their hands up like this, a lot of times baby gets stuck in that position. They don't know how to put their hands down on the ground and start to actually push the ground away and push their chest up off of the ground. So that's an important stage in the development of baby crawling. The next one is what's called commando crawling. Now, commando crawling is exactly what it sounds like. It's just baby crawling around on their tummy and moving around on the mat, getting things out of their reach. Sometimes you might have to put your hand behind baby's leg and give baby a little bit of a boost in order for baby to actually do this commando crawl. Now you can see this baby is moving around. I'm using the toys to cue him to keep on moving and be able to actually start just going about his business, doing what he needs to do. Now, you'll notice that he kind of drags one leg and pushes with one leg. And that's something I like to encourage parents to look for, is to look for those little asymmetries where baby's using one side of their body a little bit more than the other side, and keep an eye on that as baby continues to move forward. Up next, I'm going to show you the next position, which is rocking on hands and knees. Now, if you put your baby up on their hands and knees and you gently position baby's knees under their hips and just have a toy that baby can be engaged with and looking at, and just slowly start rocking baby front to back, this is a fantastic opportunity for baby to get some joint weight bearing through their arms, get some strength in the chest, the shoulders, and just be able to move front to back on their hands and knees. This is an excellent opportunity to work with your baby. Of course, you have to get down on the ground with your baby. You can see I'm giving him a little bit of support under his trunk. I'm making sure that his knees are under his hips. I'm just rocking him front to back, letting him feel how far he can move forward before he loses his center of gravity and he tips forward onto his forehead. So this is a great activity that you can do for your baby and help your baby to actually start to make that progression, moving forward and moving through the different stages of being able to crawl. You can see I'm rocking him front to back. I'm making sure that the legs stay under the hips and just letting him hang out in that position. I'm just happy that he's not crying, because he typically does not really enjoy being in this position when he is doing his pre-crawling exercises and his pre-crawling activities. So the next stage in development is baby may move from this stage and go straight into just being able to crawl around on their hands and knees, and that would be fantastic. Of course, not all babies are able to make this happen. Not all babies get to this stage. Some babies actually move around by rolling, and that is perfectly fine if your baby wants to move around and your baby moves by rolling. I actually have babies that use rolling as a way to get from one side of the room all the way to the other side. Baby will just simply roll over and then keep rolling until they are all the way on the other side of the room. So that's definitely something to keep an eye on. So I mentioned that a couple of things that impact when a baby will crawl: prematurity. You also want to pay attention to baby's environment. If baby has an opportunity and has toys around them where baby can start moving, baby will gradually start to move around on the ground. Some babies choose, instead of crawling, to do what's called a bum shuffle. This baby here that you can see, she is shuffling on her bottom and just moving around. In some cases, this is perfectly fine. I personally don't particularly care to see a baby moving like this. I will take a baby out of this position and try to cue baby to be on their hands and knees and actually move around. So now a couple of reasons why baby may be not able to crawl is that if your baby is what's called a floppy baby. Like you can see, look at baby and see that she does not have really great muscle tone. She kind of moves around. She's a little bit on the heavy side. All of these things impact if your baby is going to be able to crawl or not. There are a couple of reasons why your baby may crawl late. The first reason is if baby has low muscle tone and baby is not able to tolerate that tummy time position. If your baby cannot get on their tummy and stay on their tummy for an extended period of time, then this might be a reason why baby may not be able to tolerate, to be able to do start crawling. As you can see from this particular one, you see how what it took him to put his head down and actually just take a break. And that means that he is not showing me that he's actually ready to be up on his hands and knees and crawl. He is still kind of struggling a little bit in order to get on his hands and knees. So I have to give him a little bit more time to build up his tolerance for being on his tummy and actually before we can start moving around on the ground. Another reason is that some babies may skip steps. Some babies may go to rolling. Some babies may go to scooting on their bottom. Some babies may roll over and use that as their primary way of getting around, where baby might skip rolling and just go to crawling altogether. So let's move on and talk about when you should relax and when you should be concerned. So one, if your baby is not able to do the hands and knees. So let's start off with when you should relax. Here's when you can relax. Relax if your baby is pivoting. If your baby is making progress going from one stage to the next, to the next, to the next, then you can go ahead and begin to relax a little bit. Now, this baby, I wasn't overly concerned about him because I was starting to get him to pivot, to be able to bear his weight on his tummy for an extended period of time and be able to move and continue through the progression of learning how to crawl, going from tummy time to a tummy time pivot, then to rocking on hands and knees. Here's another one. You can, if your baby is able to rock on their hands and knees, like I'm doing here with him, rocking on his hands and knees, and your baby is able to tolerate this position, your baby is able to tolerate you pushing them around on their hands and knees, getting into being able to just take that position and stay in that position for an extended period of time, then you're on the right track and you're heading towards crawling. Your baby is making progress. And so after you start to go through these different progressions, you can worry about your baby less and less. Now, of course, if your baby is not making progress going through these progressions, if your baby is not getting to a stage where they're actually crawling, then you get to a point where you're like, okay, what do I need to do in order to get my baby going? When should I worry about my baby? So here are a couple of reasons that you would need to be concerned. If your baby is not able to bear their weight on their hands and knees in tummy time, if your baby seems like they are really struggling with just taking their weight on their arms, if you are trying to put your baby in this position, which is called a plank, and baby is not able to bear his weight in this position, if baby is not using both sides of their body equally, that's another reason for concern. If baby is moving around, let's say baby is doing more of a bum scoot, you want to keep an eye on these types of movements and make sure that baby is actually try to figure out why baby is not moving around in a normal way. Like baby is scooting, you can clearly see that she is scooting on one side of her body and showing a preference for that one side. So let's move on and talk about when you should seek help. You should seek help if your baby is not rolling, if your baby only rolls towards one side of their body and your baby does not roll towards the other side of their body. For instance, if you have a baby and your baby can only roll over towards the right side of their body, or if your baby is not able to roll at all. Now, if your baby is not able to sit up on their own by 9 months, that's another reason that you should be concerned. If your baby is stuck in sitting or they seem like they can't get out of that position, then this is cause for concern. And you want to make sure that your baby is seen by your pediatrician and go ahead and request a physical therapy evaluation. If your baby seems kind of floppy, like your baby has low muscle tone, like your baby is not able to get on their hands and knees and be able to get up and show you that they're able to get up on their hands and knees, that is cause for concern, and you definitely want to be able to go ahead and seek some further assistance. So let's talk about a couple of activities that you can do. The first one is this one, which I like to call a baby plank. You can see that I'm trying to get him to do a plank. And this was actually my very first day putting him into this position and working on him being able to bear his weight on those little hands. And you can see that I'm struggling with it. If this is the first time you're doing this with your baby, it's going to be challenging for baby. Baby has to learn this activity and then be able to apply it, make sure baby has the strength. Now, you can see that what I've done there is I've used my forearm on his bottom to kind of push his bottom down and kind of lever his body over my leg so that he can actually bear his weight and start bearing his weight on his hands. This is challenging for some babies, and I want you to be patient with your baby. Give baby some time. That was a pretty good one. But then you notice he did a face plant. So you want to make sure you're doing this on a soft surface where you have baby, where he can actually take a break when he needs to if he gets too tired, and just go ahead and put that head down and take a break. Another activity that you can do for babies, have baby reaching for toys just out of reach. So this is an activity that I like to do with kids, and I use this to have baby pivot on their tummy. And I also use this when I'm trying to cue baby to do a little bit of a commando crawl where baby can move from one place to the next. Let me pull up my commando crawling one with the baby. And you can see with this video here that I'm showing, I have him on the ground and he is moving around with his tummy in contact with the ground, which is what's called a commando crawl. And if you let baby stay on the ground, give baby lots of floor time, that is a great activity, some great activities for you to do with baby to be able to help baby to move around on the ground. That is my next tip, is lots and lots of floor time where you give baby the freedom to move around on the ground, and eventually your baby will be able to start crawling around on the ground as they move forward, and they keep getting better and better and better at this. So let's wrap up and talk about when you should refer your baby or try to get some outside help for your little one. Now, if your baby is not doing any of these activities, then that's cause for concern. You definitely want to seek a referral from a pediatric physical therapist or talk to your pediatrician and try to get some outside help in order to be able to get the help that you need for your little one. Another tip I would mention really quickly is to limit the amount of time that your baby is going to spend in things like strollers. You want to make sure that your baby is spending time on the ground and that you're able to let your baby be able to move around so that your baby can get that quality tummy time that they need. This baby is in a baby stroller. Obviously, if you're taking baby someplace, you want to have baby in a stroller, but you don't want to just be hanging out in the house and have baby in a stroller, eating in a stroller. This baby is kind of big enough to where baby can spend some time maybe in sitting, holding their bottle up rather than just hanging out in the baby stroller. All right, my friends, that's it for today. If you got value from this video, please like this video, consider subscribing to the channel, and I will see you in the next video. I'll talk to you soon.